Medial shin pain. Contraindication will be the tibia itself, so we're not going to be cupping over the tibia or the periosteum that wraps around it. So we need to be medial towards that area there. So once again, we're going to use a smaller cup this time. We're going to start down near the soleus, so one pump at all, that's all we need. Once again, it's a matter of just gauging how much pressure we've got, so we can move that quite safely without too much pinching or grabbing, and we're going to work up and along that medial compartment. So the beauty for this as well, we've got all this tissue out here as well. So we've got the gastro and the soleus, so we can cup all the way out into that area as well. Now, what we can do, every now and then I love to challenge the tissue, so we can bring the foot out and then drop it down into a version as well, and then we can start to cup through that, because we're just lifting all that superficial fascia and then cupping that up and along that area as well. So bring it right up over near that popliteus, back around over the gastro, back down again, and repeat the process. Okay, so we're not blending over onto the tibia itself, it's actually right along the back and the posterior portion of that tibia. Okay, back over gastro, down along through soleus as well, starting to lose some pressure there, so we can just increase half a pump all the way back up again, and then down and so forth. Okay, so we're going along and around and up. Okay, process goes along and then down. Okay, all right, so we continue that, give it a really good five minutes, introduce a bit of aversion as well. Off we come with the cup, then we can go in and start to do some soft tissue work here to follow that up. So we're going to use the middle finger here to come basically the posterior edge of the tibia. The next middle finger will come across, then the other one, and then we're going to use this middle finger as our guiding and as our treatment area. Okay, bring the other hand over the top, and then we're going to slowly glide along that medial compartment. Now this is just a real general rule to work through the medial compartment, so to pick up the bulk of it. But what we're going to do in a minute is we're going to become a little bit more specific with our direction and also with the area of sensitivity. So what I tend to do is with a lot of my runners is I'll get them to do a bit of a hopping test, or just a single calf raise or even a double calf raise, and try and isolate where they feel the pain when they when they're doing their running. If it's in the lower half, then I'll direct a lot of my treatment there. If it's in the upper half, then I will also address that area there. Why tibialis posterior is so important, because it controls the foot when we heel strike. So when we come down, we basically come into pronation, which is fine. Then we supinate off and then toe off. It's at that area there where we pronate that tibialis posterior kicks in. So if it's not doing its job, then unfortunately it's then creating problems elsewhere. It's the same with the gastro and soleus. So a lot of the work that we're going to be directing, if they're pain in this area here, is that I'll do specific short treatment strokes through this area for about 2 or 3 minutes. Then I'll get my client up, I'll get them to retest, go into calf raise, hopping, whatever it does that reproduces their pain, back up again, and we do that until we start to see a plateauing out. Okay, so that's the treatment sequence that we do, but keep in mind that we're working the bulk of this tissue as well. We will then swap our clients over and we will work through all the gastro and the soleus as well.